The warmer weather is here. We've seen lots of people out running, walking, biking, just enjoying this time of the year. But we also know there are people out there struggling. You're rubbing your eyes, you're thinking, when are these allergies going to go away? Maybe coughing a little bit. We set out to help you with this. We talked to an expert that can help us, get around these pesky seasonal allergies.
Yeah, Anthony, you said it best. Allergy season is definitely being felt across Georgia. And we want to talk about that for our weekly Ask a Doctor segment, where we today team up with Dr. Timothy Ryan. He is a specialty lead physician for the ears, nose, and throat, and the perfect expert to talk all things allergy. So we bring in Dr. Ryan with WellStar. I want to start by asking if it's affecting you.
Yeah, my nose tells me that it's allergy season, and allergy season has been starting earlier and earlier every year.
It is interesting that you say that, yeah, with allergies starting earlier, because I remember last year feeling the sniffles around April, and now we're looking at early March. Why is that?
Yeah, so there's two main reasons, and obviously the growing season is one of them, and with that is the weather. So as the weather warms up in the area and globally, what we see is that the pollens will start to come earlier and stronger. We're seeing some pollen days that are in the high zone as early as February now.
I know we see the pollen falling from the trees and covering cars. Are there different types of pollens to better understand and watch out for?
Yeah, so there's three main types that we talk about. Typically during this time period, we're looking at tree pollen. In the summers, we see lots of grasses, and then in the fall, we see weeds. The problem is that all three of these types of pollen can overlap each other. And that's what makes our 9-month allergy season in the Atlanta metro area so difficult.
Extremely difficult. I know we talked about the sniffles. Any other symptoms that pop up for people that might cue them that this might be seasonal allergies?
Yeah, so some of the biggest things that we hear patients complain of is nasal congestion, itchy, watery eyes, facial pain and pressure. And then you have clear nose running. You can feel that as postnasal drip or out of the front of your nose. Some people even manifest allergy, difficulty breathing, and sometimes you can get a sinus infection.
What is it about Atlanta in particular? I know for me personally, I came from a state where we didn't have a lot of pollen, and I was sure I didn't have allergies. And then since moving here, I found myself among many to be experiencing seasonal allergies. Is there anything about our geography specifically?
Yeah, so it's all of the trees. And we don't live in a significant urban environment if you're out into the metro area. We have lots of trees and grasses that emit pollen into the air. I tell my patients this is a lot like living in the middle of New York City, but with just pollen. So in New York, you have car and pollution. Here, we have grass, weeds, trees that do the same thing to us.
Anything that people can do to get ahead of it, or is this something that you are just going to have to suffer through once spring comes around?
There's lots of options. And many people in the area are on over-the-counter medications. Things like Zyrtec and Flonase, nasal saline sprays are great. There are some really simple tips and tricks that you can do to help avoid the pollen, even sitting in your nose or your upper respiratory tract long term. Avoiding going outside during those highest pollen count time periods during the day, in the morning and the evening. Keeping your window shut on high pollen count days. And then just think about it. If you come home from a day outside, change your clothes, take a shower, put HEPA filters in your rooms. Those are some small things that you can do that really have a big impact on symptoms.
And we are talking with Dr. Timothy Ryan with WellStar Health System on all things allergy season. I think one of the dangers that could come up with allergy seasons is thinking of allergies when you might have another medical concern that needs to be addressed. Are there any misunderstandings with people monitoring their health around this time?
Yeah, so one of the biggest misconceptions that we see is allergies equal sinus infection. A lot of people in the area call it the sinus. And the two big differentiating factors that we see between those two things is facial pain and pressure, nasal congestion, and your nose running doesn't necessarily mean you have an infection. Now, the color of that drainage is what separates the two. Clear drainage, you're typically dealing with allergy. If there's color in your drainage, yellow, green, or brown, you might be dealing with an infection. There's also fevers that come with infections most of the time, and then the time period. We see that the allergens in the air They have high days and low days, even during our peak seasons. If your symptoms are persistent for about 10 days or more, you could be dealing with an infection.
And what does an evaluation look like with a specialty lead such as yourself? When you come in, is it more of communicating your symptoms and ruling that it likely is allergies? Are there specific tests involved?
Yeah, so story is 9/10 of the law. We do a thorough history and physical to get your whole story, all of your symptoms, and then assess your whole upper respiratory airway tract. But from a lab standpoint, there are some draws that you can get to test for your allergies. If we do feel like you have a strong history for allergy, we'll send you to an allergist to get formal testing if needed.
And we here at Atlanta News First have the largest team of meteorologists in the Southeast. And one of the things we do every single day is give you your pollen forecast. And a lot of those days, we're going to start to see there being a high count. So is there anything that folks can do, because they still have to go to work, they still have to pick up the kids and go about their day, to protect themselves against those high pollen count days?
Yeah, masks have been shown to work a little bit. But really, it's about the prevention. And when you do get exposed to those allergens, it's about clearing things out. So one of the top tips, if you do have to go outside and you do have to be around and go to work, you can use nasal saline sprays or a sinus irrigator. And what you want to do is you want to use that through your nose, and that will rinse the pollen that gets into your respiratory tract out.
Do everything you can. It's worth it, I promise.
It really is worth it. Yeah.
It really is. I want to make sure that we talk all things allergies, get the information out there to the people. Anything else that you want to make sure folks know when they talk about their allergies, communications with their medical health provider, and just navigating this intense season that we're finding ourselves in?
It's getting worse. Don't wait. So I think a lot of people feel like when they respond to the environment and they do have allergies, that if the medicines that are over the counter aren't helping them, there's nothing that we can do. There's been significant advancements in treatments where we can target specific sources of inflammation instead of just globally treating you for your allergy. Things like biologics. You've heard of probably Dupixent, which help with everything from a chronic sinus infection to asthma. And then there's also allergy shots and allergy drops, which you can put underneath your tongue. There's been several other developments with some pills that you can take for grass allergies. So just with a few examples, you can see that there's help if you seek it. So don't wait.
And this is our weekly Ask a Doctor segment. We like to join you every Wednesday on ANF Plus, where we ask a doctor your top health questions, and some of the health news that is circling around allergy season seems to be the top discussion right now. So I want to thank Dr. Timothy Ryan here with WellStar joining us, providing this important information, and we'll have this full interview for you on AtlantaNewsFirst.com, as well as links to more information on allergies and how to connect with WellStar. Dr. Ryan, thank you so much.
Thanks for your time.
Thank you for watching ANF Plus. For more breaking news, live coverage, and your community stories, download the Atlanta News First app. You can also watch us on YouTube, Roku, Apple TV, and Fire TV. To join the conversation on YouTube Live, visit our channel and hit subscribe. You can also listen to the Atlanta News First podcast by searching Atlanta News First on your preferred listening platform.